This is the Valley's original morning magazine show, ABC 15's Sonoran Living Live. Coming up right here on Sonoran Living Live, a more natural way to lift and supplement what God gave you. The latest in augmentation coming up next. You know, for years, women have asked cosmetic surgeons, can you take me from some of the fat from like down here, maybe on your hips, and put it up here? Well, we just joked about that for years, but now the good news is you actually can do that. Dr. Todd Malan and Melinda Carroll are here to tell us about this brand new procedure. And when I say brand new, it's been around for about a year. But good morning to you both. Thanks for coming in. It's a very interesting topic.
Yes, it's one of those procedures that, again, women have asked us for many years, why can't we just do that? And they actually tried it years ago. Back in the early 80s, they gave an attempt at doing that. And the problem was getting the fat to survive. They could put the fat into the breast, but being able to create a form that was aesthetically appealing or being able to keep the fat to survive was very difficult. But we now have newer methods that we use that actually give us good fat survival and actually help us to be able to give a nice shape and form to the breast.
Let's talk about how, and I'm going to have you hold this just because we're having a few mic problems, but that's just good to go. Let's talk a little bit about how you brought a prop, and I was kind of teasing him in the green room because he put this up to his chest, and I said, you look a little bit funny, but let's talk about how this works. This is basically the key to not putting silicone into the breast, but rather just using the space. So
yeah, this is the key to the success. What we use is a splint that the patient will use for 2 weeks before the procedure to open up and create space underneath the breast, so that then we can take the fat out that we obtained during liposuction, inject it back into the breast, and then they would again wear that splint after the procedure for 2 weeks, and it helps the fat to survive. And we have a 90% fat survival.
So we're sticking this against our chest, we're suctioning so that it,
a vacuum.
a vacuum creates a vacuum, and then we're creating space underneath the wall of our chest.
Correct. They wear that at night. I mean, there are many women who, because of breastfeeding, they come in and they say, I really enjoyed the look of my breast when I was breastfeeding, and I want that fullness back because I've lost a lot of that fullness. And what we can do now is we can replace that fullness with natural fat. And that's what breasts are made of anyway, is normal natural fat. So we're just taking it out from the other area, putting it in, and this mold will help to keep that form and shape so that as the fat starts to ingrow and starts to survive, we've got a very nice, aesthetically appealing breast.
Okay, not to exclude Melinda from our conversation, because frankly, what you say is interesting, but all of the women really want to hear from her. So, Melinda, you decided to go this route. You did this just 13 days ago.
Yeah, 13 days.
And you were vacuuming 2 days later, literally.
Yeah, this procedure was so easy. It was, I felt like it was, I felt like I had worked out really hard. It was just, I felt really sore, and then that was it. Like I was vacuuming, I felt totally relaxed, and I honestly thought it was going to be more painful than it was.
Well, how uncomfortable was this little contraption?
That was awkward to wear around. I just would sleep with that at night for 2 weeks prior to my surgery, and for about 10 to 12 hours a night. And it took about one night to get used to. It was a bad night's sleep, and then after that, it just was second nature. Believe it or not, it really was. Yeah.
Second nature, Steph, just wearing those things on my chest. Well, why did you decide to go this route, and how did you find out about it as opposed to, say, silicone implants?
Well, I had heard about it just through word of mouth through friends, and I'd done some research online and found out about Smart Lipo through, on Dr. Malan's website, and I really felt good about him. I felt comfortable in his hands to do the lipo at the same time as injecting the fat from here, moving it up here. I thought it was a 2-in-1. It was a
Well, it's been a joke that women joke about this all the time. If you could just take it from here, and then you actually did it.
Yes.
And so you're pleased with the results.
Oh, I can't tell you how pleased I am. I could spend all day telling you how pleased I am.
All right. Well, I want to also ask you, Dr. Malan, is there anybody that would be not a great candidate for this?
Well, there are certain circumstances when an implant is still the preferred method. But the vast majority of women that really want to create a 1 to 2 cup size fullness or increase in their cup size, this is a wonderful method for them. It's not going to have to be replaced. The fat's going to last forever. You do not have to worry about an implant rupture. It does not interfere with your ability to obtain a mammogram later on. So it's a very natural alternative. But then there are some women who, because they have very, very small breasts and they need to have a 3-4 cup size increase, a traditional implant is still better.
We were talking a little bit before the show, and we were talking about nursing moms, and any nursing mom would tell you, yeah, they're just not the same. There's a little bit of extra sagging. So but you said those are great candidates.
Those
for
are
this.
the best. Those are truly the best candidate is someone who has a little bit of scalloping, or they've lost a little bit of the fat in their breast from having breastfed, and then they undergo that normal drooping appearance of their breast. And they don't always need a breast lift. If we could fill in that fat where that loose skin is, they can avoid undergoing a very potentially painful and disfiguring breast lift procedure.
So we're having two procedures here, really, because
Yes.
you've got the lipo, and then you've also got the augmentation. So let's, understanding that we do have procedures, let's talk about roughly what we would be talking in terms of cost compared to what we, is like $3,000 to $5,000 for a traditional.
Well, a traditional breast implant is also a 30-40 minute procedure. This is a procedure that can take 4 to 6 hours to perform because we are obtaining fat. It really depends on the individual. If they've got large quantities of fat, then of course it's easy for us to find the fat. But as we can see here as an example, she doesn't have a whole lot of fat for us to find.
I did. He's being nice.
So what we do with this procedure is we're combining liposuction with a breast augmentation, so you get the benefits of both, and it is comparable in cost to if you just had liposuction and an implant.
All right, we've just scratched the surface, but this is very interesting, and it's hallelujah for lots of women going, oh, I never knew I could really do that. I thought it was just a joke. Thank you for being on the show.
Thank you, Stephanie.
And good luck to you. You look fantastic.